Good evening. Hi, my name is Brad White, and I'm a pharmacist at the Medicine Center Pharmacy in New Philadelphia. And I wanted to share with you some information tonight about low-dose naltrexone and its potential for treating chronic conditions that are difficult to treat generally. And so I'm going to share my screen here and change it to our presentation for this evening, and we'll get started here. I appreciate everyone who's joined us tonight. I'm looking forward to your questions. So if you have questions, you can post them up here on our webinar Q&A. I'll try to keep an eye on the Facebook Live version of this program also. So, but don't be afraid to post up your questions as you have them, and I'll do my best to answer them. So last month, I had the luxury of having an expert join me, David Yezel, who shared a lot of great information and really generated a lot of interest in our community about low-dose naltrexone and the potentials that it has. And, it's an interesting opportunity for us to talk about a prescription medication that is readily available and is low cost and has a very low side effect profile, but is not well understood. So I hope to give you some background tonight, to give you some extra information to help motivate you and pique your interest possibly that it could be a solution for a condition that you or a loved one may be having. So a little bit about me and why I'm here tonight, and I appreciate you taking time out of your busy schedules to join us. There's certainly a lot going on in our world these days, and one of the reasons that I want to share the message tonight is because I've been lucky enough to be exposed to this information, and it's really helped me help patients who are desperate to find a solution. Being a pharmacist, we're often one of the most accessible healthcare professionals, and it gives us the opportunity to talk to a lot of patients on a weekly basis. And the questions and concerns that you have sometimes are difficult to vet and explain to your healthcare provider when you maybe have difficulty getting into their practice given the COVID situation, or possibly you just don't have enough time to go into detail about the particular situation you have. So at the Medicine Center, our pharmacists are available to try to help you with any number of different questions or concerns you have, whether it be medication related or looking for a provider that we have confidence in, that we can help direct you to, that have a certain specialty or certain needs that you may have. So don't be afraid to visit any one of our Medicine Center pharmacies in Canton, Louisville, New Philadelphia, or Minerva. And you could always reach us on our website too. We have the ability now to do one-on-one consults, much like this Zoom webinar we're doing tonight. So if transportation's a problem, if you've got a computer or a phone, we can make that work too. So a couple of the reasons that we're here tonight is I think that most of the questions, the most common questions I get at the pharmacy are people that are in pain or suffering. And it's a pretty staggering number to know that nearly 40 million adults suffer from some type of chronic pain in the United States. It could be from an injury. I often get a lot of questions about lower back pain. Sometimes it's questions about things like fibromyalgia, autoimmune diseases like arthritis, any number of different things. And it's one of those things that, we have a culture now in our country where for a long time patients were prescribed narcotic medications to help control their pain. And then we started to have people that unfortunately fell into a situation where they had some dependency or addiction. And it's made it difficult for some patients who have very difficult to treat pain to get relief. So one of the subjects we're going to talk about tonight may be something that could possibly help you if you're one of those people. But long story short, a lot of people are suffering from pain. And I think that it's important to understand that there are different levels and different types of pain, and they often take a very unique approach in how you treat them. Common types of pain, I mentioned low back pain or arthritis, even headaches and migraines. You can hardly turn on the TV anymore and not see a commercial for some fancy migraine or arthritis or some type of pain medication. So it's clearly something that a lot of patients are suffering from. And fibromyalgia is definitely something that it can be complicated to treat because it has so many different modalities that it that expresses in between the muscles and stress, and sometimes there's a level of depression that can come about. So a lot of different types of pain. And you could appreciate if you don't feel good, you don't want to get up and go to work. You probably aren't going to be as excited about playing with your child or your grandchild. You're not going to be able to rake leaves on a day like today, even though it's raining. You probably wouldn't want to, but it controls your daily activities, and it's going to kind of limit your enthusiasm with which you want to approach your day and enjoy it. And that's something that costs a lot of money in the US for treatment and loss of wages and insurance and things that are obstacles to living the day and the life that you want to live. Bill Gates has one of his books from years ago that he published, he had a statement in there that said, "Power comes not from knowledge kept, but from knowledge shared." So my goal tonight is to share some knowledge that I've had the luxury of being exposed to. And I think it's really needed in our community because even on our Facebook post for this event, I had a guest make some comments who said, does anyone work with this medication in our community? I've talked to 2 of my providers and neither one of them have ever heard of it. So it's great if you've got the next best invention to slice bread, but if you don't educate the patients or public and people and help them understand what it is and how to use it, it's not going to do us any good. So I want to start at the beginning here and give you a brief overview of what LDN is. LDN is low dose naltrexone, but it comes from the parent molecule of naltrexone. This particular drug's been on the market for decades. It's been something that's been around and originally used for different treatments. It's an FDA approved medication that's long been off patent. So, 2 questions that I think it's important that we talk about tonight are, why did I have to tune into Brad's webinar tonight to learn about this particular therapy? And 2, why haven't I heard about it anywhere else? And why doesn't my doctor have samples and things like that? Okay, why don't I see ads on TV for it, just like some of these other things we briefly mentioned earlier? And we're going to answer both those questions tonight. But one of the main reasons you haven't heard about this is that the medication has been in the marketplace so long that the patent has expired and no drug company can slap a pretty label on it and make those fancy ads and remarket it and make money off of it. So you have a situation where there's a medication that potentially can be very useful, but because the company can't figure out how to make money off of it, they can't slap a label on it and put it on every lunchbox. Okay. So one of the reasons that you need to be educated in a format much like this is because there are not drug reps going into your doctor talking about this medication, unfortunately. David, who was on our program last month, who was a Yale PhD and shared a lot of clinical knowledge about the background and his journey with patients who have used low-dose naltrexone, commented that the head of Mass General said that if this drug was on patent and it was still in the marketplace in a fashion that it could be marketed by drug reps and such, he said it would probably be one of the top 5 prescribed medications in the country, just because of the potential it has to help people. And I think that's something that's really important to learn about, just because it's something that you may not realize. That little bit of awareness, unfortunately, that commercial machine on the part of the drug companies makes a big difference for educating providers and patients through TV ads and things like that. So this medication was originally patented and approved for addictions like alcoholism and heroin. And there was a doctor named Dr. Bahari who was treating patients in his clinics for this. And when he was using this medication at its normal strengths of 50 to 200 milligrams, he was finding that his patients had a lot of trouble with side effects. Um, and they also had an interesting side effect of a boost of endorphins. And endorphins are those hormones that make you feel good. So if you think about, if you've ever heard about runner's high, when runners run for long distances and they just feel so good from after exercising, those endorphins not only help you feel good and give you good feelings, but they also help boost your immune system. And he just was lucky enough to think about the situation and apply it in a different area of responsibility that he had. He was a physician that was very smart and had a very well respected circle of physicians in his group. And he worked in not only in addiction medicine, but he also worked with patients that had chronic diseases like HIV and AIDS. And he was wondering, since those chronic disease states have a situation where patients often have very low endorphins, and as a result, their immune systems are very depressed, he wondered if maybe by giving a different dose of this medication, a smaller dose, if he might be able to get a boost in endorphins and see some benefits for these patients without getting all the side effects that potentially were there. So it's really interesting. Um, he found that just using a 1% of the dose of 50 milligrams would give patients a boost in endorphins for over 24 hours. And that's really interesting because the drug only lasts about 4 hours in your body. So it was something that he and his colleagues got together and thought, okay, how can this be possible? How can you give the same medication at a very small dose and get a completely different outcome for a group of patients that really had nothing else to live for. At the time, HIV and AIDS back in the late 80s and early 90s, there were not a lot of treatment options. Patients did not have long to live once their disease took hold. And he was having patients that lived much longer by using these lower doses, and they were helping boost the endorphins, which later we decided were a help for boosting their immune system. So it's something that's very interesting to take a look at. And this medication's been used in other modalities. So there's notes here, in 2003, it's been recently repatented as an injection for Vivitrol, which is also used in addiction medicine. And believe it or not, there's a commercial medication available that's combined with an antidepressant called Contrave, which is good for weight loss. So we've had patients that have used low-dose naltrexone in different strengths and have lost weight. So you're looking at a number of different things here, and we're going to talk about some more here coming up. So Dr. Bahari, as I mentioned, was one of those brilliant physicians that just asked some really good questions and was able to get a team of physicians together to start this huge explosion of research. And he found that this really, really low dose of this medication not only provided benefits by increasing endorphins, but it also gave some very low side effects, and it had some outcomes that they really didn't understand. And it wasn't until the late 2000s, 2007, 2009, that we got some research articles out of some very reputable organizations like Penn State and Stanford, where they started to look at, okay, why does this work? You may not realize there's an awful lot of medications on the market today that we don't really know the exact mechanism, if you will, as to why it works. And this was a perfect example. So back when Dr. Bahari made this discovery, it was believed that we had one mechanism that helped patients with their chronic diseases, and that was that boosting endorphins. And now we believe there's up to 5 different mechanisms that work together across a variety of forms. So we'll talk about that here shortly. But what I want to point out is that just from back in 1985, when Dr. Bahari discovered this, to 2020, we've gone from basically zero to over 1,200 research articles in well-respected journals that have dug in and studied patient populations across a variety of disease states, especially autoimmune diseases and chronic pain, and most recently even depression and dermatology. So it's fascinating to look at the overall application of such a simple medication. So if you want to kind of geek out on the fancy words for the science and stuff here, we've got a number of different mechanisms that we believe that Dr. Pradeep Chopra has come to discover through his research at Brown Medical School. We mentioned boosting endorphins already. There's a number of other things that we've discovered that low-dose naltrexone can do, and one of them is really focused around inflammation. Inflammation is really the root of all chronic disease. When you think about arthritis, you've got those swelling and inflammation of the joints, which causes decreased range of movement and pain and stiffness in the joints. When you think about cardiovascular disease and plaque buildup in the arteries, you've got inflammation of those heart and artery muscles that cause problems with circulation and increased blood pressure and risk of stroke and heart attack. So there's a number of different disease states that their underlying problem is all inflammation. And so LDN really appears to have the potential to be some level of a disease-modifying mechanism. So an immunomodulator, if you will, to both reduce inflammation and help modulate the immune system to try to get it back to functioning the way that it really should. So that's something that we're going to talk about here tonight. And I wanted to point out to you too that it's not just in the scientific literature that we're seeing information about low-dose naltrexone. Just last year, we had a very, very good article put out by NPR. It was actually a short radio program. And if you go to our website, it's listed at medshoprx.com/low-dose-naltrexone. There's a number of different articles and published studies and things there that you can use for reference. But this article is simply about this nice lady, Lori Pinkley, who was really frustrated. And it's a theme that I hear at the pharmacy and at these programs quite a bit. She'd been to multiple doctors. She'd tried all kinds of medications, and she still didn't feel good. She didn't feel like she could get out of bed in the morning and attack the day. It was one of those frustrating situations where she's like, there has to be a better way. And through educating herself through some different organizations that we're going to talk about here, and she was able to find a provider that allowed her to try low-dose naltrexone for her chronic pain. And I'm really glad that NPR put this forth. The good thing about an article like this is it's not biased. It features this woman's struggle against her condition, because you can label someone with a disease, they have diabetes, they have fibromyalgia, they have arthritis. But that disease isn't just a name or a label. That particular condition affects the entire person's way of life and outlook. We commented a little bit ago about a situation where if you don't feel like you can get up and get out of bed in the morning, can you not go to the grocery to buy food? Can you not walk around the block with your grandson? These things all weigh on you, and those things can build up and cause some depression and some frustrated feelings, which magnifies your pain. It's a very frustrating cycle. So this particular article is a very short read. It's an excellent document that you can share with your doctor. And I'm going to show you some other resources here in a little bit that you can use also. But it's something that I encourage you to read it because you might identify with her struggle. There might be some aspect of it that makes you think, you know what, I felt the same way. AARP magazine. What's more popular than AARP? It's a name, they had an article last November about inflammation's impact on chronic disease and how it affects the brain and the cardiovascular system and cancers and different situations like migraines and inflammation seems to be the root cause of many diseases. It is possible that low-dose naltrexone can help reduce those inflammatory markers by decreasing that cytokine cascade, which causes inflammation in the body. So it's something to be considered. It may not be the golden goose, if you will, but it certainly could be a factor in helping control some of the disease states that we're going to talk about tonight. Other exciting opportunities for education, as providers that go to conferences, get a lot of education from their colleagues and the presenters. Most of the conferences our providers and physicians and nurse practitioners go to are sponsored by big drug companies. And as a result, a medication like this is probably not going to be brought up. We're fortunate to have a group called the LDN Research Trust.org that has been around for years, and they have held multiple international LDN conferences. The last one was in 2019. The next one's going to be next year in Philadelphia. And basically, it's a gathering of providers from all over the world, pharmacists and physicians and nurses and patients that come together and share their stories and their research about how low-dose naltrexone has affected their particular life and disease states. So if you're listening to our program tonight and you have Crohn's, or you have rheumatoid arthritis, or you have some type of cancer, or you've got psoriasis, or you've got fibromyalgia, I can help provide you and your doctor or your provider programs from this conference, PowerPoints and slides and research studies that show different disease states and how this particular medication can help give you some foundation and some education based on what has been possible for other patients and providers. So it's exciting to know that there's this particular drive just to share information. I want to share a brief study that the group I'm working with has done, and we're working with a group across the US of pharmacists and providers and researchers to try to kind of gather this information to spread this education. It's that education is shared theory. And we surveyed a group of our patients a couple years back and looked at what they were taking and why they were taking it. And the really, really interesting thing is if you've ever heard of low-dose naltrexone, or you've taken it and it hasn't worked for you, or if you've never heard of it, a lot has changed in the last 4 years. If your provider has heard of LDN and they haven't done any reading or research or kept up on it in the last 4 years, they really need to contact us at the Medicine Center and help us provide some education, because a lot's changed. And in the beginning, everybody thought that the magic dose was 4.5 milligrams. So this particular study actually highlights the fact that most of the patients we were dealing with were on one of 3 strengths, and over half of them were on this 4.5 milligram strength. And the exciting part is that we got a lot of patients that got benefit. Many of them didn't have side effects. As you can see, 87% of our sample did not have side effects. Some had some insomnia in the first 4 days. Some had some vivid dreams. In my opinion, most patients tell me they have some very vivid dreams in the first week, and then they resolve after that. And sometimes you get some headache. The interesting thing is these patients came from a variety of walks of life, from a variety of different specialists and providers, and they were using medication for low-dose naltrexone to treat a number of different disease states like this across the spectrum. And when you look at this list, if you think about it, many of these conditions on here have an underlying cause of inflammation or some type of immune system dysfunction. And that's what I think kind of brings all this together. LDN wasn't designed to be an immunomodulator or designed to be an anti-inflammatory. it was really a medication that was discovered by accident at a very low dose by a very smart physician who had some good questions and some applications, which started this huge cascade of research that's helped millions of people. And we think it's something that has a lot of potential to help more people if we apply it in the right fashion. And the interesting thing is just with the basic disease state profile and strengths, patients were able to get over an 80% success rate. When's the last time you did anything and you got an 84% success rate on average? I mean, I wish all of our investment portfolios were 84% successful, or our test scores were all 84% successful, or every time that we decided to take on a new challenge, we were 84% successful. So it's a pretty exciting thing. And I wanted to share a couple outtakes from this particular study we did, because what we had patients do was we just had them fill out a form and say, can you share what you felt like before you took LDN? And can you share what you felt like after it? And one of the most profound people that we've talked with is one who had the bottom one here. She commented that she had chronic pain on a daily basis. She was no longer able to work. And at times she was on the couch for days at a time due to pain. She was taking gabapentin to control the symptoms, 900 milligrams 3 times a day, which is a ridiculously enormous dose. It makes my stomach hurt just thinking about it. And she was in a secretarial position, and her hand was so bad that she couldn't hold her pen anymore, or she couldn't hold a pencil, and she couldn't type. And so she lost her job. And it was really disappointing to hear about how, again, you've got a condition like psoriasis, which doesn't sound like a big deal, but it affected her whole life. I mean, she lost her job and her income. So she had been to everybody. She's from Wisconsin. And she'd been to the Mayo Clinic. She'd been to a number of dermatologists, and she tried all kinds of creams and drugs and everything, and nothing worked. So she finally found a provider after learning about low-dose naltrexone and said, hey, I've tried everything. Can we please just try this? Because I'm at my wit's end. I have to find a solution. And happily, after doing so, she had some really fascinating results. So this is her hand before she started low-dose naltrexone. And then 8 weeks later, this is what her hand looked like after. Now, the picture looks really good here. It's not completely healed, but she was able to return to many of her normal activities of daily living. And as a result of being inspired by this, she went back to school and got a nursing degree, and now she works as a nurse. But the frustrating part is she had to go back to her original prescriber, who wouldn't give her the chance to try LDN, and say, look, you're the dermatologist. This is a dermatological condition. You wouldn't let me try this. You need to know about this medication because it could help other people. And to the provider's credit, he now uses it in his practice and has had a number of successes with other patients. So, we're all sometimes intimidated by what we don't know. And we all have a tendency to be very judgmental when we are confronted with a subject that we are not confident in, because especially as a medical professional, we don't want to look like we don't know what we're talking about. And we don't want to be surprised by something that someone walks into the doctor's office or the pharmacy with. So I commend the providers who are willing to be open to learning about something new. And the great thing about this is we can do this in a fashion with some really great research. So this is a comment she gave after that her psoriasis is 95% improved. She can flex her thumb. She can walk with her children to school, and she's got more energy, and she's off the gabapentin. She was on 900 milligrams of gabapentin 3 times a day. So that's really cool. So those are the kind of stories that really are rewarding and we enjoy to be part of as a provider, that we can help patients find a solution. And, it's important that we look at a condition like this. You can't do this alone. It's very important that you are honest with your pharmacist and your pharmacist. We're kind of in an environment now where there's a lot of confusion and disruption in the insurance space and what's covered and what's not. The physicians are in a challenging role right now because of COVID, and sometimes they have to use telehealth to communicate with you rather than going to see them face to face. But that doesn't mean they can't help you. And then you, the patient, need to really demand more of your pharmacist and physician and your health plan for that matter. But one of the things that we've tried to do in our group of research pharmacists and colleagues is we've tried to group together the physician and the patient and the pharmacist. And we've really put the researcher in the middle of that so that we can try to help combine all this stuff and make it accessible to both you, the patient, and the provider, so we can help build bridges and move forward. One of the ways we've done this is we're providing education like these flyers. We have these flyers in doctors' offices all over the county. Some of the providers really like these because it's a four-page document that actually helps educate you, the patient, on what LDN is, how it works, what it can be used potentially for, and what applications from some noted research studies have shown the results to be. This helps give the provider more time in the practice because it has valid references to scientific studies. It helps give them education in an easy to read format so that the patient can review it on their own time and the doctor can focus on what's important at the visit rather than spending 10 or 12 minutes explaining what LDN is and how it works. So I encourage you to look at that. You can find this on our website also. We can also provide providers with sample prescription templates. In this age of electronic prescriptions, it's sometimes challenging to write for custom medications. And low-dose naltrexone is a custom medication. It's not something you're going to find at Rite Aid or Walgreens. While you can find naltrexone there, the doses that you might require for treating a particular condition like we're talking tonight are going to range anywhere from 1 microgram to maybe 6 to 9 milligrams. So we started out making and compounding 3 different strengths of LDN in the beginning. And today we use 23 different strengths. So it's highly customizable based on the situation and your condition. And it's one of these things that you can use across a wide variety of autoimmune and chronic pain conditions. So there's a number of different things that we can talk about with your provider. We have special packets and binders set up for both patients and providers. Let's see if I can get this in my screen. But we have a really nice binder that gives a number of different conditions for you, the patient. And then for your provider, we can design a custom packet for them. So if they're in the cancer specialty or the dermatology specialty, we can provide studies that are tailored to those conditions that the doctors are going to see on a daily basis in their practice. So that's something that we've been told is really valuable. So in one of the landmark articles that originally came out, and probably one of the reasons that we see most prescribed in our practice right now, is fibromyalgia patients. And these are situations that fibromyalgia is a really challenging condition to treat. And this study was one of the landmark studies that was done. And this was back when we only knew about limited number of strengths. So patients taking 4.5 milligrams over 3 months saw a 30% reduction in pain. So if you've got a high pain score, a 30% reduction doesn't sound like a lot, but that could be the difference between you being able to hold down your job or get out of bed and go to the grocery in the morning. So that's a significant increase. And now that we can customize the dose, a lot of the patients that we see getting benefit from fibromyalgia treatment through LDN are closer to the 3 milligram range. So that's something to keep in mind. Just because there's a cookie cutter dose out there that was done in a study like this, it doesn't mean it's the study, or it doesn't mean it's the strength for you. And it's quite possible that you may very well have a dose that is specific to your situation because you may have more going on. We recently had a patient, for example, that had a number of different conditions going on. They had psoriasis, they had fibromyalgia, and they also had some depression. So as a result, all those things might change how we dose it, the strengths we dose it, and the time of day we dose it. So I'm going to take a drink of water here. Bear with me a moment. Okay, sorry about that. So customization is a very important thing. And much like different medications need to be tailored to your particular need, this is no different. One of the most exciting changes in the last couple of years has kind of turned LDN dosing on its head. And we call it hybrid dosing because it sounds fancy. But really what it means is dosing more than once a day. Traditionally, LDN is only dosed in the evening. But Harvard did a study and found out for patients with depression that a low dose in the morning, like 1 milligram, in this case, this study did 1 milligram twice a day. BID is fancy Latin terms for twice a day. So 1 milligram of LDN twice a day showed a substantial and rapid improvement in depression scores. They go so far as to say in this article that LDN is better than drugs like Prozac for treating depression. And that's a pretty big thing coming out of Harvard, who's very well known for its research in depression and mental disorders. So it's something to keep in mind. Other educational resources. The LDN book, Volume 1, has been out for years. The LDN Volume 2 is coming out as we speak. These are both accessible and easy to read books that you can share with your provider and you can gain more knowledge of. They're broken down into disease states. So you can read about thyroid conditions, you can read about arthritis, you can read about fibromyalgia. There's even a chapter in the book about how to talk to your provider and try to communicate with them and share an idea that they may not be familiar with, like LDN. So it's really an asset, and it's helped millions of people throughout the world. Linda Elsegood, who is the editor of this book, I've had the luxury of meeting. She is based in the UK, and she used to be wheelchair bound. Her particular condition was so bad that she had tried everything, and it was kind of through message boards and bulletin boards on the internet that she found out how to apply LDN to her situation, and it changed her life. And so she made it her mission to share the LDN information with the world. And her organization has been a driving organization behind educating patients and providers around the world. So it's been very exciting. Some of the new uses I touched on, dermatology like psoriasis or Hailey-Hailey disease, which is a very difficult condition to treat. Mental health. Mental health has a lot of potential because mental health actually has overtones to a lot of chronic pain patients. Patients with lower back pain or arthritis who can't do what they want to do or who are not sleeping well. All those things add up into more stress and in depression and magnified pain. So it's very possible that LDN's true benefit may really be the sweet spot maybe in mental health and to help patients cope with conditions that they've dealt with for years. And that's really exciting. Given the opioid crisis that I talked about earlier, there's an opportunity here where we can possibly help patients with chronic pain. And you don't have to take a narcotic, which means you don't have to worry about being drowsy at work. You don't have to worry about being impaired during your driving. You can climb stairs without, worrying about increased fall risk. There's a lot of different ways to look at these situations and deal with that underlying cause rather than trying to just put a Band-Aid on a symptom. So I touched on new dosing schedules. If you or a loved one or if you're a provider listening and, you just write 1 milligram, 3 milligram, 4.5 milligram, there's a lot more now to dosing than just those three strengths. So I encourage you to reach out to us and learn more about it. One of the things that we're finding is that if you look at between 0 milligrams and 6 milligrams as kind of a range, we're finding that that patients between 0 and 3 milligrams, we call it the left shift, if you will. Those patients with mental health and thyroid conditions seem to be served best between 1 and 3 milligrams. And then patients between 3 and 6 milligrams tend to be served best if they have dermatology or chronic pain symptoms or traditional autoimmune diseases like rheumatoid arthritis. So those are something that to keep in mind as just an example of how the things have changed. 4.5 milligram is not perfect for everybody. And if we can increase our success rates from about 50%, like some of these studies mentioned that just used 4.5 milligram, to over 85% if we dial in that dose and that therapy. And I touched on hybrid dosing, how we can use divided dosing throughout the day. So, recently we had a fibromyalgia patient that wasn't sleeping well and was really depressed. So we had her worked with her doctor and she's using a divided dose. So she's using a small dose in the morning, like a 0.5 milligram, and then her higher dose in the evening. And we get like a spread out version where she gets benefits for mental health benefits and she gets benefits for fibromyalgia, and her dosing schedule lasts throughout the day. And as a result, it's more consistent. So it's something to keep in mind, to think openly about how dosing customization can help improve patient outcomes. So I'm going to flash through a couple slides here. And, if anybody has questions, feel free to post them up. And I'm going to jump over to the Facebook feeds and see if there's questions there. But all these conditions are chronic conditions where the immune system is not functioning up to what we would expect it to. And as a result, on some level, there's an impact on the patient that affects the whole body or the outlook. You don't really think about things like eczema or, inflammation of different skin tissues and things as being an issue that is a whole body issue. You kind of tend to think that if it's on your hand, it's just there. But oftentimes that inflammation goes deeper and it's something that can be a whole body situation. And I think that's why fibromyalgia is a good example of a condition where it's not just one part of your body generally that's affected. It can be your whole body, and inflammation is widespread. It's not normally isolated to just one area in your body. So a number of different conditions here where everything in red here are patients that our particular group of pharmacists have had patients that have had success, celiac disease, Crohn's disease, ulcerative colitis. There's really good studies with data to show positive outcomes for patients that have both used the standard of care and also have used it in addition to the standard of care to get a better outcome. Lyme disease, here in the Midwest, we've had a significant challenge with ticks and tick-borne illnesses, and Lyme disease is no different. Lyme disease in itself is an underlying condition that has chronic inflammation, and it's quite possible that LDN could benefit if you have that condition. There's different studies for cancer and breast cancer and lung cancer. I have studies that show that actually have scans, PET scans and CAT scans that show reduction of cancer-sized tumors after stretches where patients had tried everything and failed, and they basically were either, it's a little morbid, they were either told that they were waiting to die or there was nothing else they could do because of their other underlying conditions, and a stint of LDN really helped them. So that's exciting to see too. So multiple sclerosis, restless leg, Parkinson's disease, anxiety, panic disorders, depression. There's actually some studies in the military going on right now with PTSD where they're looking at LDN to see if that can benefit soldiers that are suffering from those conditions. So that's really exciting. And sleep issues. So I guess I want to stress that the speed of change is really amazing. In 2015, there were 252 articles on PubMed, and PubMed is kind of like the Google for medical articles, if you will. And we were only using 3 doses, 1 milligram, 4.5, or 1 milligram, 3 milligram, and 4.5 milligram predominantly. And today, there's over 1,200 articles, and at our pharmacy, we're using between 23. I guess my slide now says 24. So we must have a new dose in the last week. So, doses can be customized infinitely. And that's the great thing about a compounding pharmacy like ours. We have an accredited lab where we're accredited by PCAB, which is a national organization. We're one of only a couple hundred pharmacies in the country that have actually achieved this accreditation, so you can be confident in our process. And it helps us solve problems that the big drug companies aren't able to focus on because, sometimes customizing dosages and dosage forms in a fashion that isn't scalable makes it difficult for them to do. So we have these monthly seminars. And the interesting thing is I've had the luxury of speaking at a number of small groups. I was fortunate enough to talk with the pain support group at the Cleveland Clinic earlier this year before COVID got going. And that was really great to talk to patients. And it's challenging to hear stories of people who are trying to find a better way to live their life. And if this is something that might be able to help you, I hope that we can provide some additional education. If you'd like to stop in the Medicine Center in New Philly, we can get you one of these binders and give you some extra information. There's information on our website at medshoprx.com/low-dose naltrexone. And we can also talk to your provider. So I often get the question from people, well, what doctor is writing this medication? And I've got dozens of doctors that write for this medication, but I think it's important that you talk to your provider. I'm not trying to replace your provider. I just want to educate them. And whether it be a general practitioner or an internal medicine doctor or a rheumatologist, all providers see patients on a daily basis that have migraines and arthritis and fibromyalgia and depression and chronic issues. So it's something that we're happy. We can set up Zoom meetings like this with the doctor so we can maintain social distancing and things like that. We can do it over their lunch hour before they start, or sometimes we're able to go into their practice if that works for them and educate them. So this is kind of a process, and it's something that we've been dedicated to do over the last year. COVID's gotten in the way a little bit of spreading this educational information. And, but you know what? It's not going to hold us back because I feel like there's methods where we can record a program like this and then share it on our website for patients that weren't able to attend at this time. So I have a couple questions here that I want to look through and make sure I cover for you. Okay. So here's a question about side effects. And side effects are something that can be extremely frustrating. And I can totally appreciate the fact that you want to make sure that you're not going to put yourself in harm's way. One of the things we can do is work with you as far as your other medications. So I don't know what this particular patient's taking, but let's say, for example, this patient is taking some type of opioid medication because they have chronic lower back pain. There are ways that we can tailor low-dose naltrexone now to help give you benefit for inflammation and pain without conflicting with your opioid medications. We have to watch time of day dosing and strengths, but that's something that can be customized. As far as most common side effects, I mentioned earlier in the program, but it's something that I want to make sure we bring up again. Most common is insomnia. Insomnia can happen. It's not uncommon. Vivid dreams is very popular. But even at very popular, it's only about 12% of the particular population that we get reporting it. And it's generally only lasts between 3 to 5 days. So, I have a funny story I can tell you. And I just want to stress the fact that the side effects people report don't normally cause them to stop taking something. Okay. So for example, this nice older lady told us a story about how she has her cat, and it's just her and her cat because her husband passed away years ago. And so she commented that her cat sleeps on the foot of her bed, and she tells her cat goodnight when she goes to bed at night. And that's that. Well, one night she said, after she started taking LDN the first day or two, she said goodnight to her cat, and she was glad that we told her she could have vivid dreams because she was believing that her cat said goodnight back to her, but then started to give her the what for because the cat didn't like its cat food. So she said, I was really glad you told me that I could have vivid dreams because the cat was talking back to me. And if I didn't know about that, I would have been a little worried. So it's those kind of light mood things that kind of make you realize that, you watch some of these TV ads and you see that you could have nausea and vomiting and blurred vision and high blood pressure and all kinds of crazy stuff. Some of the side effects they read off in the TV ads are longer than the drug pitch, if you will. But I would just encourage you to reach out and try to think about LDN and learn more about it. If you have any type of autoimmune condition or any chronic disease that has inflammation as a foundation, it's something that I'm happy to talk more with you about. So that's the side effect question is a really good one. Another person has questions about compounding pharmacy and what exactly is that? Okay. A compounding pharmacy is a pharmacy that can make custom dosage forms. So 50, 60 years ago, there weren't drug companies like we have today that made a lot of capsules and tablets and injections and things like that. A lot of products were compounded or mixed, if you will, in the pharmacy. If you're a baker, you get it. Okay. You bake your cookies, you bake your cakes, you combine ingredients to have an outcome, and you have a recipe you follow. As an accredited compounding pharmacy, we have recipes for different products and medications. So, for example, one of the most common things we prepare are seizure medications for children that can't swallow tablets. So very commonly, we'll get prescriptions from pediatricians for children that have seizures or heart conditions that we need to put their medication in a suspension or a liquid form so that they can get that medication. Another example is a patient that might be on hospice and has difficulty swallowing. We could prepare creams and gels that can go on their wrists or their skin that help deliver medications for nausea or anxiety. And it helps give them a method to deliver medication to their system without having it to be by mouth, because maybe that's compromised because of a cancer or a condition. So those are two examples. Another example that a compounding pharmacy can serve is for your little furry friends. So, whether it be your dog or cat, we take care of a lot of cats that have thyroid conditions. We have different conditions for, we've had some different conditions that happen for, we've had some chickens and some snakes and some parakeets and things. All these animals often have issues just like we do. They might need an antibiotic for an infection. They might have a situation where they've been injured and they need to make sure that they can get treatment to help heal their particular tissues or skin. So compounding pharmacies serve a need. I think the best example of what a compounding pharmacy or a compounding pharmacist does is an IV. And while we don't prepare IVs at the medicine center, if you've ever been in the hospital and you or a loved one has had an IV, you've had a compound medication. So take comfort in the fact that it can still be the standard of care. It still requires a prescription, and we can work with your provider to customize a dose or a strength. You might have a condition where you can't take lactose or red dye number 6 or whatever. We can make you a capsule or a product that removes those allergens from it so that you don't have those allergic reactions. So that's kind of an exciting way that we're able to help patients too. All right, let me check my other questions here. Is LDN expensive? Okay, that's a great question. The great answer is no. LDN is not expensive. Often it is less than a cup of coffee a day. And the great thing about LDN is it's cost effective. Depending on what quantity you get, it can be less than $1 a day, depending on the strength and the duration. You're going to have a low side effect profile. And there's such good results and studies out there that there's low risk to try it. So there's a lot of good reasons to consider LDN. Sometimes insurance companies will cover it. Sometimes they won't. But even if they won't, oftentimes it doesn't cost you more than what your non-preferred or your brand name copay would be for your drug. So that's an excellent question. I'm glad you asked that. All right, we're getting close to 8 o'clock here. Let me check and see what other questions we've got here. Local providers. Oh, here's a really good one. Okay, so this question comes from Tom, and Tom says, I asked my doctor about low-dose naltrexone, but the doctor said they couldn't prescribe it. Okay. This, I think, is a perfect situation where the provider is probably thinking about the regular strength naltrexone 50 to 200 milligram that is used in addiction medicine. So your provider, while with the best intentions that they educated you, is misinformed. Any doctor with prescribing authority in the state of Ohio can prescribe low-dose naltrexone. They just need to know how, and they need to know what strength and what dosing schedule to do it. So that's something that we can help them with. You don't have to have a special license to prescribe low-dose naltrexone, but you do need to know what you're doing. And I think it's very important that providers understand that it isn't just write it and forget it, because you may end up with an outcome that doesn't help you or the patient. And, I guess if the doctor just writes a particular strength, if they just write you 4.5 milligrams, it might work for you. Great. You need to realize that sometimes the duration of time is a couple weeks, and sometimes it's a couple months. Recently, we had a patient with a number of underlying conditions that it took them almost 3 months to see some significant benefit. And it was almost like a light switch went on. They were using their medication for a long period, or for the first couple months. They saw a little bit of benefit, and we encouraged them to keep doing it and keep trying it so that they could make sure that they got the full benefit, because sometimes it just takes a little bit more time. And just recently, they have seen a significant increase in their benefits. So I think that's really exciting for patients to understand. I will admit I am one of the most impatient persons. We want instant gratification. We want to get results quickly, and it isn't always possible. So sometimes we have to be a little patient. We have to give our bodies some time to reset, if you will. And you have to realize that there are times where, when your body's been under assault for such a long period of time, it may take some time to kind of get back to even. And that's one of those things that can be a really important thing. So that's all the questions that I see in the chats. If you have any follow-up questions, by all means, you can respond to the email that you'll get after this program. I really appreciate you taking time out of your busy schedules to learn and listen. And if you have a provider you would like me to reach out to, I'd be happy to do so. And if you'd like to come by the Medicine Center in New Philadelphia, you can get one of these binders. I can make arrangements to have some of them sent to our other locations. If you ask about Brad's webinar, we'll be having another one of these very soon. I don't have the date published yet. I'm trying to work around our holiday schedules with Thanksgiving and Christmas coming up here, and to find the best time. And I'd like to have a guest speaker come on again. And so that will be something that we'll be publishing soon. So thank you very much for attending. I hope you all have a great evening, and be well and be safe. Thank you very much. Bye-bye.